being an old neurologist, let's say, I remember when I first got in the field of MS, we really had nothing, just steroids. We used to treat people with steroids during their attacks. There were some options of choosing some immunosuppressants, but nothing really came out of that. And today, we have lots of treatments which are becoming more and more effective in treating MS. So I think this is also very exciting. From nowhere, we came to not to everything, but we had a great progress in MS. So now we have the oral therapies, we have the many biological therapies, and we still have now the so-called good old injectable therapies. And I think there is one individual with MS who might be suiting any of these therapies, who might be good for any of them. So it's not that the new therapies are, through them we are leaving the old one. No, every form of therapy has its own patient. So we have a lot of options. And it's now we see with some, let's say, I cannot say anymore natural history study, but therapeutic history studies, that the people with MS who develop secondary progressive or a significant disability is now much, much less than what it was 20 years ago. So this is good for our people with MS, and it's good for us that we can, and we see that we can do something, we can give them more hope. And there are now more and more therapies coming. The only problem is that the more effective a therapy is, the more significant side effects, risks they have. So probably in the future, if we will have safety and efficacy going together, when more efficacy and less safety concerns, that will be great. And maybe one final, not final, but one other expectations that I have from what we are doing today is that with the molecular biology and genetics getting more and more involved in our daily practice, not yet, but in the near future, I guess, we'll be able to predict who will develop what form of disease, benign disease versus aggressive disease, and who will need treatment and what treatment, who may develop severe side effects and who may not. So now we will be able to talk about an individualized evidence-based medicine, which I think will be great.